I'm Dr. Nasser. I'm the medical director of the Acute Rehabilitation Unit at Palmdale Regional Medical Center. So we have an acute rehabilitation department. It's a transition to home for people who have had major medical problems or have become deteriorated and can't care for themselves. And the way that we do it here, by involving the family, involving multiple specialties, and involving an entire team, we have found to be not only per protocol, but extremely effective. And we've been able to help quite a few people get home and get back to the way they were prior to their trauma or their illness or whatever has occurred.
Within the first 24 hours of admission, you will meet your entire team. You will meet your clinical care coordinator, you will meet your RN, you will meet your physician, and then of course you will meet your therapist that will evaluate you and set goals with you and create an individualized plan of care that we had talked about. And then the rehab begins.
The physician and this entire team, we all sit at a big table like Thanksgiving and we discuss these patients and we go over every single detail of their family life, how they're walking, how they're caring for themselves, what are their medical conditions. And as a team, we have this huge collaboration on how many days we believe the patient needs to be in rehab, what types of adjustments we need to make to their therapies or their medications or their diet or whatever it's going to be. There is no other setting in any hospital, any nursing home, anywhere else where that type of meticulous attention to a patient's daily needs and life is paid. While this may be 2 or 3 weeks of my life, which is a blink and I don't remember it, this is a significant 2 or 3 weeks of their life that they will never forget. The things that we say to them, the activities, the things that we were able to be part of in their lives. And that is such a monumental task. It takes a whole team. It takes a village to really help these people get back there.
To tell a patient, we've graduated the program, it's time that we're going to get you home. And they love it so much here that they don't want to go home. They want to stay here. Right. They love the unit, they love the doctors, they love the administrator. It's a great place to work at. At one time we had a husband and a wife here. Both were patients. Both of them had medical needs. They were both hospitalized, simultaneously, and we brought both patients here. And the ADL room was perfect. Getting them in that home environment with a queen size bed that they have at home is something that's nice.
It continues on. We have a fantastic outpatient program that we really love to transition patients to. Having that jovial, lighthearted interaction with the patient sets the tone and the climate and the culture of our rehab unit. And they don't feel like they're just, oh my gosh, I had a stroke, I'm here to die. No, we're here to get you back. We're here to get you back to where you were. We have patients in our practice that had brain injuries 20 years ago. They're still coming to see us. Spinal cord injuries 15 years ago, still coming to see us, and we're seeing them on a regular basis. That's something you have forever. So equipping these patients with the intellect, the resources, the ability, and their families to live with that condition for the long term, I think that's when we really hit the home run. Because you'd have the patient would come back a year after their discharge, 2 years after their discharge, 3 years after, and you would come and we'd see all these people and you'd be like, oh my gosh, look at how incredible you look. You're actually, last time I saw you, you were in a wheelchair and now you're walking. And they bring their families in and they tell us about the successes that they have in their lives and how they're doing after they've left rehabilitation. I mean, I tell you, that's worth more than anybody could pay me. Just to see those people come back and to know that you were part of their life in that moment, in that time, and what they did. It's just fantastic. It's just it's like you can't be part of anything more exciting.